What actually is pneumonia? It starts with a cough. Then comes the fever, the chills, and the feeling that every breath is harder than the last. Is it just a bad cold or something more dangerous? Let's talk about pneumonia, what it is, how it spreads, and how to protect yourself. A brief history of pneumonia in the U.S. Pneumonia has been around for centuries, and it's been one of the deadliest infectious diseases in history. In the 1800s, before antibiotics, pneumonia was known as the captain of the men of death. Even President William Henry Harrison died of pneumonia just 32 days after taking office. Then came a major breakthrough. In 1928, Alexander Fleming discovered penicillin, the first antibiotic, which revolutionized pneumonia treatment. Today, pneumonia still kills thousands every year, especially the very young, the elderly, and those with weakened immune systems. But thanks to vaccines, antibiotics, and better healthcare, we now have ways to fight back. What is pneumonia? Pneumonia is a serious lung infection that causes inflammation in the air sacs of the lungs. These tiny air sacs, called alveoli, usually fill with air when you breathe. But with pneumonia, they fill with pus and fluid, making it hard to breathe. Pneumonia can be caused by bacteria. The most common is Streptococcus pneumonia. Viruses, including influenza and COVID-19. Fungi, rare, but can affect people with weak immune systems. How does pneumonia spread? Pneumonia is contagious and spreads through 1. Airborne droplets when an infected person coughs or sneezes. 2. Touching contaminated surfaces, then touching your face. 3. Aspiration, accidentally inhaling bacteria from the mouth or throat into the lungs, often in older adults. How pneumonia attacks your body. Once inside the lungs, pneumonia-causing microbes multiply rapidly, triggering an immune response. Your body fights back by sending immune cells to destroy the infection, but this also causes swelling and fluid buildup in the lungs, reduced oxygen exchange, making breathing harder. Fever and chills as the body tries to kill the infection. If left untreated, pneumonia can lead to serious complications like respiratory failure, when the lungs can't get enough oxygen. Sepsis, a life-threatening infection spreading through the body. Lung abscesses, pockets of pus forming in the lungs. Signs and symptoms of pneumonia. Pneumonia symptoms can range from mild to severe. Cough, often producing green, yellow, or bloody mucus. Fever and chills, usually high fever, sometimes with sweating. Shortness of breath, feeling like you can't get enough air. Chest pain, sharp pain when breathing or coughing. Fatigue and weakness, feeling completely drained. Confusion, especially in older adults. For some, pneumonia can feel like a really bad flu, but for others, it can become life-threatening. When to see a doctor. If you have pneumonia, don't wait too long to get help. Seek medical attention if you have difficulty breathing, chest pain that gets worse, high fever above 102 degrees Fahrenheit or 39 degrees Celsius, that won't go down, bluish lips or fingertips, low oxygen levels, confusion or extreme fatigue. For infants, older adults, and people with chronic conditions, pneumonia can be especially dangerous, so early treatment is critical. How to prevent pneumonia. The good news: you can lower your risk of pneumonia with these steps. 1. Get vaccinated. There are pneumonia vaccines for high-risk groups, and the flu shot helps prevent viral pneumonia. 2. Wash your hands. Keeps bacteria and viruses from spreading. 3. Quit smoking. Smoking damages the lungs and increases pneumonia risk. 4. Stay healthy. Eat well, exercise, and get enough sleep to keep your immune system strong. 5. Cover your coughs and sneezes. Prevents spreading germs to others. If you do get sick, treat it early before it becomes serious. Conclusion: pneumonia is serious, but preventable pneumonia can be mild or deadly, depending on your age, health, and how soon you get treatment. But with the right precautions, you can protect yourself and others.